a seminar titled At Least One More Governmental Seat for Africa on the Global Fund Board, facilitated by a distinguished professor and director of the Infectious Diseases and Oncology Research Institute at Wits University, will take place next month. Now, this is aimed at interrogating what reforms can drive Africa's shift to self-reliance in global health and how the continent's representation on the Global Fund to fight AIDS, TB and malaria could achieve this objective. Currently, the continent receives 71% of the Global Fund, yet only holds 10% of voting seats on the institution's governing body. Now, let's discuss this with one of the panellists, Chair in Political Theology and Global Health Policy at Leeds University, Professor Garrett Brown, and Co-executive Director of Supporting Health Initiatives, Robyn Hayes-Badenhorst. Thank you both for your time. It's quite a, startling figure when you hear that Africa receives 71% of that global fund, but only holds 10% of the seat. It has to ask, one has to ask, how could adding just one more governmental seat change the way discussions are made for Africa and its health priorities?
Yeah, to answer that question, if you're talking about 10% of the voting on the board, and the board makes all the decisions in terms of how the Global Fund operates, but also what gets funded and what doesn't get funded, it has to go through board approval, then you're talking about a lack of proportional representation. So that's the first issue. The second issue is that we've known for a long time that aid effectiveness is increased if you have increased national ownership. So it's very hard to say that contextual concerns on the ground from an African perspective are getting fed into those decision-making processes. How the Global Fund works, what gets funded, what doesn't get funded, how it gets funded, how it gets monitored and evaluated. And the argument is that, well, you need that information from the ground. You need to support national ownership. And the first way of doing that is increasing representation on the board. And that would increase the national ownership. For sure, also increase proportional representation and try to get the Global Fund to be more aligned with who it's supposed to help. And that's our argument that we're making.
Yeah. And Robyn, funding cuts from major donors like the US and Germany have really shaken the system. How urgent is it for Africa to have that stronger representation on the Global Fund board right now?
It really is urgent now, Veronica. The Global Fund is facing a $1.4 billion US cut. And when resources are tight, people who face the biggest burden must help decide how money is used.
And one might even have to ask, is that one extra seat really enough to make a difference? Perhaps maybe take us to the ground, the reality of just what that seat might do, and importantly, that increase in funding as well.
Well, to answer that question, currently... sorry.
Yeah.
Well, sorry,
go for
Robyn.
it, Garrett. No,
yeah.
Go for it, Garrett.
All right, thank you.
Oh, I was going to say, well, currently
the
the two seats on the Global Fund board represent 47 countries. So let's just say at least one additional seat. You're now distributing those constituencies across more representation. So you think those 47 countries in Africa all have distinct operating environments. They have their own contextual needs, different disease burdens, different health system strengths and weaknesses. So you're just getting more voices from the ground into representation that can then present that to the board. And I think that's a major first step, because what we have now in the Global Fund and with many global institutions is a kind of one-size-fits-all model, which is, they call them traveling models, where you just sort of use what you use in Rwanda and you try to plug it into Zimbabwe, but you have an entirely different situation in which you need to do that. So one thing that would be helpful is to have people who know these contextual moderators and can sit on the board and say, look, we need to do this differently because it's not working. We have seen improvement, and the Global Fund does some amazing things. But we haven't seen the kind of improvement that would correspond with the type of funding that we have seen go into it. So there are efficiencies to be had. There are ways to use that money better. And one of those ways is to get the people on the ground who understand the problems to help design the policies to fix them.
Yeah, and you've painted that picture. I think, Robyn, the same question to you as well. the difference that one seat will make on, the ground exactly? How would that play out?
Well, I mean, echoing what Professor Brown has just said, the two seats cover West and Central Africa, and then East and Southern Africa. And together, as Prof. Brown said earlier, they represent 47 countries and over 70% of the fund allocation. So it's a heavy load for two voices, and no other region carries this weight with so little say. So it really is important for Africa to have at least one additional voting seat.
And the conversation as well, Robyn, around Africa's, independence and reliance, specifically as well when it comes to health. We often talk about other issues when it is that conversation about self-reliance, but very little the conversation is had about, this in the health sector. How do we balance essentially having to finance and, having to balance local responsibility with the need for international support?
Yeah, I'm going to point that at Garrett. He led the research on this, and I think he will be able to articulate this a lot better than what I will.
Yeah.
Garrett, could you step in here?
Yeah, I mean, absolutely. I mean, this doesn't absolve states from their responsibility, and we know that there's been chronic underfunding of health systems across the world, not just in Africa. This is a trend. I mean, the latest figure shows that post-COVID debt servicing has reduced health budgets by 8.9%. That doesn't sound like a lot, but 8.9% is quite a lot when you're already on a shoestring and you're already just delivering the basic level of healthcare in many environments. So I think it's huge for national governments need to take ownership. They need to fund these things better. There has been an over-reliance on these institutions, and I think one way that can be done better is if there is a voice on these institutions to suggest, look, what we need here is a bridge, not a dependency model. And we need to rethink the way we do these financing models so that we're actually building sustainable models in the long run. I mean, people forget the Global Fund was not supposed to be a full-time institution. It was supposed to be a temporary institution. Now it's become entrenched, and they've almost made themselves indispensable. That's not what we want. What we want is these institutions to strengthen local systems in partnership with those locals. Those locals are investing in their health systems and building those health systems. So one day it becomes redundant. Yeah. You don't need the Global Fund anymore. That's the ideal. But we're nowhere near coming towards that. And I think that's what we're trying to point out in this report.
And still a lot of reliance. Just a final question for you as well, Robyn. Ahead of that G20 meeting, what message would you like global leaders, especially when we talk about the fact that this needs to be done with, to hear about the importance of African voices, especially when it comes to global health policy?
Thank you, Veronica. That's actually a really pertinent point, and it's a message to get across. And it is. We've earned our place. We deliver the programs. We carry the burden, and we understand context. And now we must stand together and claim the voice that we deserve. And that would be my key message to get across to African governments, especially coming up to the G20.
Certainly. Well, those were the Chair in Political Theology and Global Health Policy at Leeds University, Professor Garrett Brown, and of course the Co-Executive Director of Supporting Health Initiatives, Robyn Hayes-Badenhorst, speaking to us about definitely an important conversation regarding Africa's reliance in terms of health.